Which, Your Honors, before I recognize the distinguished lady, we'll have a short caucus.
We will have a
in
short
the
caucus.
lounge. Yes.
Yes, Mr.
The distinguished lady senator from Taguig and Pateros, the Republic of the Philippines, Senator Pia Cayetano, is recognized. Ma'am.
Good afternoon, colleagues. My speech is about my visit to Korea, representing our Senate. So, with the permission of the body, I will now deliver my report. Let me start with a very common statement. I may not pronounce it well, but for those of you who watch K-drama, annyeonghaseyo.
Annyeonghaseyo.
So, na-practice ko yon. Nagamit ko naman yun ng madalas. Mr. President, as I said, I rise today on a matter of personal and collective privilege to report on my participation in the Asia-Pacific Parliamentarian Forum on Global Health held last August 24 and 25, followed by a leadership conference the next day as the sole representative of the Philippine Congress. As an overview, the Asia-Pacific Parliamentary Forum is a platform for parliamentarians to exchange ideas, build political will, enhance capacities, and foster collaboration in driving sustainable action for health. It was established in 2015 by the National Assembly of the Republic of Korea with the support of WHO. The Philippines has actually been a host in 2018. So this meeting is the fifth, I believe, the sixth, which was held in Seoul, Korea. Mr. President, the first day were back-to-back sessions that started at 8 a.m. and ended at 8 p.m. The first session was on the learnings and improving the COVID response. My initial, my takeaway here is that many of us experienced very similar responses. It really was just a matter of how fast or how slow those responses were. Many countries gave some form of ayuda. Again, depending on the country, it would just be a matter of how small or how big the ayuda was. Session 2 was on investing in resilient health system. This is the session that I had the opportunity to discuss the frailness of our human health resource. You will recall, especially the members of last Congress, that the Doktor Para sa Bayan was defended by our majority floor leader and co-sponsored by many of us. So I explained how this bill made use of future thinking's tool to not just provide for scholarships for doctors, but to ensure that there was infrastructure and budgets and capacity building for all the state universities and colleges that would be home to the future doctors. It was also through my intervention that the budget will continue to include, and I hope we will be able to continue it, budgets for the rest of the human health care resource and not just the doctors, because I also shared that we do have the ability to meet our demand for doctors in a number of years. But for nurses, we will not be able to reach that demand unless we change things drastically. So I will not go into details, but I shared this during the second session. The third session was harnessing innovation, and we had a very, very interesting presentation by Dr. Gauden Galea, who is the WHO representative to China. He presented the future vision for public health, which included an operational shift towards innovation. He said there is no way that we will be able to achieve our goals for public health unless we harness the creativity of people in different sectors. And I wish I had a photo. I will probably just present it another time. May I just also ask my team to change the photos, because there were lots of photos. Thank you. He actually presented a photo of Amorsolo, but there you go, superimposed this with, and I'm not sure if I have the details right now, because my staff who went with me are still looking at the CD to contain it. But anyway, he used this this is actually art, because he was saying that for innovations in healthcare, we need to look towards art. And without being able to appreciate art in its different forms, it will be even harder to think of technology and healthcare as we need to use it in the future. He also mentioned that the use of AI and creativity will be very vital for the healthcare system. Our own Dr. Beverly Ho of the Department of Health also made a presentation virtually in this session. In session 4, which was on opportunities for parliamentarians to support health system resilience, the representative from WHO discussed legally binding agreements such as treaties that members of parliaments can use as their tools to strengthen healthcare systems. Interestingly, the very important convention that was the convention that she used is one of the few that I am very familiar with, and this is the Framework Convention on Tobacco Control, which the Philippines is a signatory to, and which was the very first international treaty negotiated under the auspices of WHO. You will recall, dear colleagues, that many of the treaties don't deal with health, they deal with other matters, so this was a very important piece of this is a very important international agreement which showed how other subject matters, including health, can be the subject of treaties. This was a long day, Mr. President. As I said, 8 a.m. to 8 p.m. For those of us who go to conferences, we look forward to the coffee break. But here in this WHO conference, there was not just a coffee break, but a mobility break. And I will share this with you. I don't think we need this in session, but this may be something of interest to us in long hearings, including the budget hearings. So this is our mobility break, dear colleagues. They had a video of K-pop, two dancers dancing to K-pop. It's not my strength, but I participated nonetheless. And it was one whole song. I proudly will tell you all that for somebody who's not a dancer, I participated for the whole song. There's a 2-minute version, but I will spare you that version. So, and then there was still coffee and tea after that. The next day, Mr. President, to me was more interesting because here we were seated all day. Okay, now we can move on to other videos. There were 2 tracks. Sige, kung may music, ipapakita ko sa inyo yung sample mamaya. There were 2 tracks. One was on pandemic preparedness and response. And this group visited the National Biobank of Korea, Korea Disease Control and Prevention Agency, and the Osong Advanced Medical Complex. I was very interested in this because I authored and heard the bill. I authored and was prepared to sponsor the bill along with the committee chairman, Senator Bongo, on our own version of a CDC. However, I made the tough decision to join the track 2, which was on health innovation. The committee I chair is the Committee on SDGs, Innovation and Futures Thinking, and thus I felt I should attend this one. So here you are. I'm showing you a picture where I am using a virtual reality gadget, and I am actually inside an operating room. I didn't feel like I was just watching a video. I felt like I was at the operating table. And apparently in Korea, they launched this during the pandemic, but now they are making use of this as much as possible because it will allow medical students and even specialists to share their talent with medical students and other doctors. And I share this with all of you because especially those who, like me, were sponsors of the Doktor Para sa Bayan, this would actually allow, like I said, med students in far-flung areas to engage or to at least be present. I'm not kidding. I was like 1 meter away from the operating table. I really felt like I was there. So I'm sharing these kind of innovations because this is what makes our job a little bit more exciting than the usual review of documents. The other VR experience I had, I didn't have it, I watched it, is they perform CPR on a mannequin. It shows how a student would be taught. And apparently, he is receiving instructions exactly on how to do CPR, like more pressure, less pressure, move your hands. so on and so forth. Interestingly, dear colleagues, especially those of the last Congress, you will be happy to note that we funded an even more sophisticated version of this, minus the VR part, but the mannequin type that would be used in operations for PGH. Na FLR yan in the first for the 2021 budget, but for 2022, I believe that this will materialize, and I invite all of you, let us see it in action when it is actually delivered to PGH. Yung sa atin na in order for PGH is the whole body. Yeah, so it was actually initiated by a professor of OB-GYN in PGH. So yung sa atin, ginagamit yon para turuan yung mga estudyante kung how to handle births. Okay, so there was also then the other experience, and it was also very interesting to me. We weren't really allowed to take photos because the information there is confidential. It's not as if we would understand it because it's in Korean. But for those of you who have visited command centers, it looked like a typical command center. Like we have one in Taguig City. I visited the one in Baguio. But this one is a command center in a hospital in Seoul National University, wherein they can see the data from a primary healthcare hospital that doesn't have the sophistication and the expertise that is available in SNU. So the specialty doctors here can actually see the vital signs and the condition of a patient in an ICU of a different hospital and can make interventions as necessary. Again, I believe this is a tool that we could also make use of because that is a problem that we also have in our country. There are not enough specialists to go around the country. There was then also a visit to the Korea Social Security System where they explained to us how the institution was responsible for the overall management and coordination of various social security data in Korea, including data from public health centers. So apparently, and this was explained to me by our ambassador to Korea, Ambassador Tess De Vega, that your cell phone is connected to all your data, and you cannot change your cell phone on a whim because it will interfere with all the data that the country has collected for you. I don't know how you, parang hindi naman you have to go to court, but that was the feeling I got, that it's very difficult to change it. Anyway, then finally we went back to session and we had a presentation by various startups. I don't know if any of you saw the Korean teleserye Startup, but parang ganon. I had a live presentation from various startups. One was Crypto Lab, which was a contact tracing app that compares users' routes with the COVID-19 positive users' routes through GPS. Then there was Korea's #1 medical checkup platform known as KindDoc 2022 and more. So that was the second day. On the last day, which was a optional event, but it was also hosted in Korea. This was the Executive Leadership Development course on social health insurance. I decided to attend because no matter how much I've learned about social health insurance, universal health care, there is really so much more to learn. And the first session conducted by Professor Bong Min Yang, Professor Emeritus of the Graduate Studies of Public Health of SNU, gave us a very good overview of universal healthcare in Korea, including some comparisons with other countries. It was a great review for me because he discussed the different payment schemes which are at the heart of equitable and sustainable rollout of universal healthcare. I know our colleague, the former chairman of the Committee on Health, Senator JV, is familiar with this because during the time I made amendments to PhilHealth, and then His Honor made further amendments for the latest universal health care we have. We've changed our payment systems. For the information of the body, because you may be asking this during future hearings, please be guided by this because this is very, very important. There are 3 types of payment schemes. The first is fee for service, wherein every single treatment procedure and service will be charged. We used to use this in PhilHealth. Ito yung kada karayom, kada bulak, kada dextrose na gagamitin, i-charge yan sa'yo, bawat isa. So, syempre, yung mas murang ospital, mas mura yung charge, yung mas mahal. Pero, ito yung, they consider this very costly because there is no limit to what could be charged. And this is actually the system in Korea, which the good professor gently criticized. Thankfully, and I was very proud to whisper to our neighbor, to my seatmate, that yung seatmate ko, yun, yung katabi ko, sabi ko, we are no longer in the fee-for-service. We are now in the case rate. In the case of case rate, based on studies done, they average the amount that whole procedure or treatment will cost. So this one is capped. And it is considered to be a much, much better system than fee-for-service. The problem, though, is this has to be updated constantly because if it's not up to date, nalulugi din naman yung mga ospital. So, and I think some of our colleagues will recall, you remember what they call the upcycling or upgrading of yung pneumonia, yung i-charge ka for pneumonia, which is a 3-day upcasing, there you go. They will charge you for pneumonia even if your ailment is just a cough and cold because our system is not yet sophisticated enough to have those different variances and we don't have outpatient treatment. So there are many cases where the intention is good because they want to treat the patient, but the patient does not even have to be confined. Maybe he could just be in the ER. But because he will not be able to get any kind of reimbursement for that kind of service, they will upcase him or her to pneumonia. So these are growing pains that we should grow out of soon enough because the case rate system can be quite effective if it is accurately and properly utilized. Finally, which is considered the best system, is the capitation or global budget system. This is where a fee is paid to a provider for the provision of services for a fixed period, usually 1 year, irrespective of what clinical services are required. So let me illustrate. The way this works is you would roll this out in a city. So let's say in Taguig City, you would determine the number of residents, and there would be an average amount that would be determined to take care of those people. So say, and I think the figure given to us in one hearing was it 1,300 per person? Something like that. Does anyone in my team remember? Anyway, I recall it to be something like 1,300. This is outpatient care. So let's say 1,300 people times 1,300 pesos times 1 million residents. That amount will now be divided among the healthcare providers, and bahala sila to make that amount fit for the delivery of healthcare in the country, in that particular area. Apparently, this has been tested in a few areas, and for the last 2 budget season, I have been waiting for clarity on the rollout of these these test areas so that we could institutionalize it and provide a budget, because this outpatient budget is very, very important. Finally, I come to an end to my presentation. And these are after the conference. The conference is the three sessions ended on Friday, so I had the weekend to myself. And I just wanted to share that the South Koreans are known to be very health conscious. I had the opportunity to visit Korea for the very first time in the 1990s. And I went hiking, and I was shocked by the number of people who were hiking, the number of Koreans who were hiking. So this is actually Mount Ansal, which was less than 30 minutes outside of the city. And you can actually see the city from the view. So I just wanted to share that they have done many things to make having a healthy lifestyle even easier. I think I have a photo or a video of the trail where they even put wooden trails throughout the, is it shown? Is it going to be shown? Wooden trails throughout the mountain to make it easier. And it is even wheelchair friendly. you can push your loved one in a wheelchair in the mountain so that they can also enjoy the benefits of being in the mountain. And then the other one that I wanted to share, can you show the photo? Another, not the hiking anymore. The previous slide. Yes, okay. So this is a Korean MP. I think, is her name on my file? Do I have her name? Anyway, this is a Korean NP who was our host. If you look closely at the photo, and I also asked, there you go, she has this in her calling card, and she proudly told me that that is a Filipino baby because she came to Korea when she was a younger doctor. She came to Korea, sorry. She went to Yolanda to be part of a rescue mission and stayed there for about 1 week. So she is a doctor and a member of parliament. And this is her calling card with a Filipino baby. Her name is Dr. Hyun Young Deborah Shin. So these are some of the things that I wanted to share. I may have a part 2, Mr. President, to share my other learnings, which were, there's quite a few more, but at least based on the conference, this is my official report for representing the Senate. Thank you, Mr. President.
Majority Leader.
Yes, Mr. President. There are no other member who wish to interpolate, Mr. President. But let me just point out, Mr. President, one, sana all, and two, as we listen carefully to the privileged speech of our distinguished colleague from Taguig and Pateros, and she made mention about Dr. Para sa Bayan, Mr. President. Just to put on record, since the passage of the measure, we were able to open at least 7 state college and universities, Mr. President, for the Dr. Para sa Bayan. And fortunately, looking at the 2023 budget, the medical scholarship for existing medical students, only 167 million. The medical scholarship and return service, which is the under Dr. Para sa Bayan law, is lower by half, Mr. President. From 500 million, it's down to 250 million. And there's no seed fund this coming 2023, Mr. President, while in 2022, we have 250 million for seed fund. I just want to put that on record. It's a great concern from this representation, and I'm sure from our dear colleagues. Mr. President,
When you mentioned, Your Honor, Majority Leader, sana all na makavisit din sa Korea.
Sana all makavisit sa Korea at sana
There's
all,
a next trip
Mr.
going
President,
towards Rwanda if you want to be appointed to the Rwanda head
Mr.
of
President,
the Rwanda delegation.
because Senator J.V. Ejercito already signed up, Mr. President. So I don't
He's
want
heading
to,
the delegation to Rwanda.
I don't want
Okay.
to compete with our
Yes,
seatmate,
yes.
Mr. President.
Baka hindi na paalisin yan, si Senator Jamie.
Yes, Mr. President, our Deputy Majority Leader is seeking
Yes,
the floor.
Deputy
And
Majority
would
Leader,
recognize
Senator J.V.
Ejercito.
Thank you, Mr. President. I'd just like to commend Senator Pia for representing the Philippine Senate in the concluded leadership program on healthcare. And probably what she has learned, knowledge that she has gained, she can impart with us, especially that the universal healthcare law is still a work in progress, no, Mr. President. It's a 10-year program, so there's still a lot of things that need to be ironed out. It's experiencing birth pains, yes, but I think through her knowledge that she gained, probably she can share the best practices that she has learned in Korea with the improvement, the continuous improvement of the universal healthcare law. That's all. I'd like to commend Senator Pia again for representing the Philippine Senate very well. Thank you.
Thank you.
Thank you, Mr. President, to our colleague who also spent so much hours, sweat, blood, and tears to pass the universal healthcare law as it is, which, by the way, because His Honor was not here during at the height of the pandemic, a lot of the things that we had to do were made possible by that law, including putting into action the work of HTAC, the Health Technological Committee. So thank you for that, Your Honor.
Thank you. Before we recognize the Minority Floor Leader, may I ask if the Senate President Pro Tem to replace me? I need to go for a liquidity break. Session suspended for 1 second.